Yeah.
All right. Well, let's go ahead and get this meeting started. This is the September 22nd El Paso County Public Health Board of Health meeting. And we have at least five board members between present and virtual signing in. Thank you all for signing in. Particularly Commissioner Bremer, thanks for signing in. I know you're supposed to be in two places at the same time. So thank you so much. Thank you very much. Thanks for attending.
Sure, thank you.
Let's go ahead and do a roll call just to make sure who all's here. I see Commissioner Bremer. I see Commissioner Bremer. Councilmember Geek. Councilmember Geek here. Kari. Is Kari on? Not coming. Boris here. Dr. Boris here. Dr. Vu. I'm here. How about our chief? How about our chief? Leon, he's out of town, and we know he's out of town, and we know we're missing our other our other county commissioner and Colorado Springs Councilmember Dave Donaldson. They're also in DC. So here's what I'd like to do, if it's okay, sort of call in an audible, as they do in football, and move the action items, of which there are several, but none of them look too onerous. Move the action items up, and then we can really kind of linger longer on our Heroes of Public Health, our Public Health Champion Awards, which I'd really like to do. So you've had a chance to, with that change, you've had a chance to see the agenda, and if it looks okay, I'd entertain a motion.
Second.
All in favor?
Aye.
Anybody against? Nope. Okay. And let's move here to approval of minutes. The minutes from the August 25th, 2021 Board of Health meeting. And board members, that's in your packet. Hope you've had a chance to look at that. And if that seems well and good, I'd entertain the motion to approve that.
Second.
In favor?
Aye.
Anybody
Aye.
against? Okay. Moving swiftly along, we're to finance and budget already. And that's Lori and Samantha. Lori, do you want to lead on this one?
Sure. Good morning, Board of Health members. This is Lori Clayton with Financial Services Budget Division. And what I have here today is the August financial report. Do you have that up there? There we go. So what we have here is the revenues, the overall revenues through August are pretty much trending as we've been seeing all year. You know, some of those have been down due to the shifting of resources to COVID response. They have gotten slightly better through August. We have been receiving quite a bit more of the reimbursements for the immunization and the epidemiology activity. So those overall revenues are starting to look a little bit better. On the expenditure side, we are still showing quite a bit of underspending in both personnel and operating. And a lot of the underspending in the personnel area can really be attributed mainly to the large number of vacancies that we've had with public health. One of the challenges that we've seen lately is just the HR staffing not being able to keep up with the demand of the hiring that public health has been needing to fill those vacancies. So that is one challenge we are looking into. Overall, as we stand through August, revenues less expenditures, we're showing a net impact to the positive of $1,117,178. So that has come up quite a bit since July and looks good. And we have no concerns really with all the additional funding that we've been receiving for the COVID response. Through August, we have no concerns at this time. Are there any questions?
Questions for Lori about the financial report? No, that looks pretty good.
Okay.
We have two contracts to approve.
Yes,
And,
we do have two contract renewals. The first one is the Women, Infants, and Children, or WIC, Breastfeeding Peer Counselor contract. We have for this one seen a slight increase of 15% from last year. The contract amount on this is $127,667. And the goal of this is to increase initiation and duration of breastfeeding rates in El Paso County. Are there any questions on that renewal?
About the WIC breastfeeding contract? Let's move to number 2, maternal child health.
Okay, the second contract renewal that we have is the maternal and child health contract. In the past, this was actually 2 programs, the HCP care coordination and the maternal child health child and adolescent program. For this year, these have been combined into 1 program for maternal and child health, and the actual funding amount has not changed. So that has remained the same at $615,272. Are there any questions on that one?
Questions from board members about maternal child health or either of these contracts? We've seen these before.
Yes,
They
these
come
are
up annually. They're
renewals.
part of our bread and butter services at the health department, and these have not changed substantially from previous. Is that correct?
That is correct. These are just renewals, and there was just the slight 15% increase to the breastfeeding peer
Well, that's
counselor.
good. All right, so I'd entertain a motion to approve both of these contracts.
This is Commissioner Brimmer. I'd like to
Yes.
make a motion to approve them both.
Please. Go ahead.
Oh, I think there's a delay. I'd like to make a motion to approve both of these.
Okay, we got you. And I think we have a second here in the room. And okay, all in favor of approving these 2 contracts?
Aye.
Aye.
Anyone opposed? All right, they're approved. Yes, Cammie, there's about a 3-second delay, which ensures that you have the last word on any subject. So you're good.
Thank you.
All right, let's see. New business. This is a little more meaty, but let's see. This is approval of a lease for the City of Fountain and Mount Carmel occupancy at Public Health South. So, Susan, do you want me to take these bullet points, or we have a subject matter expert in the room?
I think that, everyone is aware that we had purchased the building in 2020 to serve the southern portion of the county better, given the dramatic increases of population over the last decade, as well as military partners in that area. And we had always intended to further collaboration efforts and share space with some of our partners. And this is what this lease amounts to. We certainly are not making any money off of this lease. It is just to help pay for the ongoing costs. And so this is a lease that we have worked diligently with the City of Fountain, and that would be the Scott Trainer, as well as the Todd Evans. And also we have our board member, Sam Geek, who is on the City of Fountain's council, and you all have approved the lease as well. And this is a formal process to where, since the Board of Health has purchased the building, that you all have the say-so in who you will be leasing to or not. We've worked with our attorneys as well as our finance department to develop and present this lease.
Okay, and I assume it's had a good look over by our El Paso County attorneys.
Absolutely.
Okay.
Not only our county attorney, Diana May, but also our support, Mary Ritchie from for Public Health, and also Lori Seago, who is involved in the purchase as well. And the City of Fountain's attorney has reviewed it well. So it's reviewed numerous times.
Good. Well, those attorneys keep us out of trouble.
Yeah.
I think, again, this is a terrific resource that we have, our public health office there in Fountain, and again, Fountain's help and support with that. The lease is 14 pages. And so I'm going to break with tradition a little bit and not read all 14 pages. Board members, you have that in your packet, the lease. It's been reviewed numerous times, as we've heard, by lawyers on all sides. And the attachments are there as well.
And I would point out too that, you know, with the City of Fountain, we also are partnering with Mount Carmel to have some occupancy of the space.
You know, maybe a little bit more about Mount Carmel. I know that Mount Carmel provides a variety of services for veterans, service members, their families, and since their inception, they've really made a tremendous impact by virtue of the fact that we have so many military members in the southern part of the county. Having Mount Carmel partner with us there at that location will be particularly appropriate.
Yeah, and at some point too, we will have a ribbon cutting. We are doing a few upgrades there for safety and professionalism. But since we purchased the building in 2020 and just giving where we are with our COVID response, we are have delayed that ribbon cutting. So know that we will invite the City of Fountain as well as all board members and others to join us in that, to have another walkthrough. That place has been, the location has been wonderful in the COVID response. We still continue to provide testing, COVID testing there. We still provide vaccinations there.
Yeah.
The schedules are on our website. When the demand was extremely high, we're doing a lot more, but we're still trying to be pretty steady. And we also will talk later around how we're gearing up also for boosters as well as the 5 to 11-year-old age group.
Excellent. Any board member comments or questions about this lease for our Public Health South site? Yes, Dr. Vu.
I apologize, I'm not clear on this. I'm assuming the lease is for one space. That space, the use of that space is shared by City of Fountain and Mount Carmel, is that correct?
Yes, and I don't think you had a chance to be there, but through one of the entrances, there's our Women's, Infant, and Children Clinic, and then on the other side will be the space for the City of Fountain, which they have a behavioral health unit, which will occupy that space to really model after the Sheriff's Office, the Beacon unit, to help people that are having some needs in the behavioral health arena. And we also want to build relationships with our clients and in that area with law enforcement. And so they will have a steady presence in that area. It's also for Mount Carmel. And the lease is an agreement, essentially just kind of the rules and the pretty standard in some of the costs.
Thank you. Therefore, there's no TI allowance in the lease then.
Which allowance?
Tenant improvement allowance.
Tenant improvement? No. I think monies for improving the space will likely come out of the public health budget.
So, and that's something that will probably on an ongoing basis. When we purchased the building in 2020, the City of Fountain, their city council had stepped up and said that they would improve the parking lot area. And so they had also agreed to pay for ADA upgrades in some of the bathrooms. And so if memory serves me, it was around $150,000 that the City of Fountain was so eager to partner with us that they had approved some funding. So the City of Fountain have been I can't stress enough how fabulous they've been related to time and resources. Anything we need, whether it's from the chief of police or the administration or the city council, they have been so favorable in helping us work through that. And you know, sometimes it's time, sometimes it's financial, but it's really been a tremendous partnership. Great question.
Yeah.
And I apologize, I forget that you were not here in 2020.
Okay, thank you.
Yes.
And I'd like to add that we're currently looking at adding another beacon unit. The unit that's there now is only there 3 days a week, excuse me.
Okay.
And we're looking to add another unit, so there will be another clinician down there, so they'll have 6 days a week of coverage. So it's made a big difference, and the council is 100% support as far as I know.
Yeah. Well, that
And we
is-
really appreciate what's happening down there. We're thankful.
Yeah, and so are we, because, you know, given, you know, where we are, you know, just within the state of COVID response and mental health needs, I mean, I think that this really comes at a great time where you're pairing law enforcement with behavioral health clinicians to really meet people where they are and provide them the right service at the right time. And so I think that is really exciting for public health and many team members that have been involved in 5 years ago and trying to put that model together for the sheriff's office. And now it's expanding because it is a best practice model. And our medical director has been highly involved, tremendous. When she used to work at the fire department, she was one of the leaders that had initiated the crisis response teams and serves on the behavioral health steering committee, governance, and so she's provided a lot of expertise into a framework and being able to implement these models effectively in El Paso County.
Very good. Commissioner Bremer, I think you have your hand up there, please.
Yes, thank you. You know, this was always kind of the vision for how we could and would utilize this building. So I'm happy to see that we found a way to do that and realize that, you know, these partners and others that might come along in the future, you know, those are all part of kind of the bigger picture of what health looks like in our community. They're addressing different needs with different communities, and that's what public health is all about. So I'm happy to see that this actually came to fruition, and I'm grateful for our partners as well.
Very well said. Yes. Dr. Bill, oh, Doris.
Sorry.
Yes, please, go
On
ahead.
page 4, number 10, I just would like some clarification because I don't understand. It's got trash services and building security service, 1/3 plus 2/3. What does that mean?
Okay.
On
Number
page
10.
4, number 10.
Page 4 of the lease. Landlord's maintenance responsibilities.
Down about halfway.
Yeah, so those are what we will be responsible for. Landlord will normally be responsible for the following utilities and service in connection with the leased premises.
I just didn't understand what the 1/3 plus 2/3, what that meant, because there's none of that on the other line items there.
From the trash service?
Yeah, there's nothing else, anything there. I just was curious. It's just a small thing. I was curious on what that really meant. I didn't know if maybe that meant that the leases were going to pay 1/3 and then the public health was paying 2/3 on those, or why that would be
A shared,
singled out.
why that
Yeah,
would be a shared responsibility.
I don't know if Lori Clayton or Diana May, if you have the fine detail on that bullet.
It's the same thing with building security.
Yeah, Bill. Any help with this?
Sorry,
You can-
this is
Go
trying to
ahead.
get off mute. I do not have any fine detail on the reasoning behind that.
Okay.
Bill reviews it just from the legal aspects, not necessarily like the need aspect of why.
Okay,
I was just curious.
so it's an
Hi,
equitable sharing
This is Lori.
of the cost of security and the trash service. Yes. Any other comments?
Lori's on there.
Lori's on there?
Yeah,
Okay.
I don't have any input as to the detail on that either.
Well, and I do know, and we'll get the detail and share that, but given that they are law enforcement, the rationale there was that we would, public health, have to pay reduced security costs because they're in the building and their presence alone, and being such good partners that they go above and beyond to ensure that there's safety at that building. So I'll get you the fine detail, but that's probably why it's written like that.
Okay. Well, I would suggest that neither one of those particular things are going to be showstoppers. And we have time here for another question or comment from a Board of Health member about this lease.
Can I have
Yes,
I'm also assuming that tenants will intend to renew the lease soon because the termination date is December 31st, 2021.
Yes.
Thank you.
Yes. Well, I'll make a comment. I think this is more than we expected, better than we hoped for, and I'm particularly enamored with the partnership of public health and public safety. I've always thought that that was terribly important to have that partnership, and in many ways our mission sets are blended. So again, thanks to all of our partners, particularly City of Fountain, for helping to make this happen. Any other comments or questions about the lease? If not, I'd entertain a motion to approve.
So moved.
We have Councilmember Sam Geek making the motion, Dr. Vu second, and we'll take a vote. All in favor of approving the lease?
Aye.
Any opposed? Okay, that's approved. Now, I think that brings us to the end of the action items. So Commissioner Bremer, if you need to spin off to your assigned duties there in Washington, D.C., I appreciate you signing in today. And let's move back to the top. Go ahead.
She'll stay on as long as she can.
Oh, okay, great. Good to have you.
Thank you.
Board of Health member comments. We're back up to number 3. I'm looking for raised hands. No? Well, I'll have a comment, which is that going through the slide deck, a lot of our public health director's report today is going to be about schools and children and preventive measures. And so I really I know that Director Whelan and her team have been working extremely hard in the past month with that subject and with that partnership. And so I look forward to her comments a little bit later.
And I will add that we've got Dr. Wendy Verhansel on the Teams call, who is the superintendent of Harrison School District 2, that will join us within that update when we get there.
Great. Welcome. Welcome. Okay. I think we're up to one of our favorite parts, which is the Public Health Champion or Heroes of Public Health awards. So, Susan, you want to lead with that one?
Sure.
Okay.
So we always recognize public health champions, individuals who have went above and beyond on a broader scope within the work that they do. And we have a couple of groups to recognize today. And so we'll go ahead and start off with Operation House Call, which there are 5 groups that will be recognized within this effort. It is really a great collaboration that is occurring to serve the public. And I also want to say, if we put it in perspective around what they're doing as it relates to going into homes that have people who are experiencing barriers, providing the vaccinations. If they do, let's just say, 5 per day, and we can give some information on like if our hospitals are seeing, 1 to 2 to 3 to 4 and maybe as high as, 10 admissions per day from El Paso County. Just think about the impact that we're having when people get vaccinated, especially the ones that are immune compromised or having barriers or older and really might not be able to be as mobile. And so these are this effort is kind of heaven sent. I know that I've received some feedback and just how wonderful this team is and knowing that this service is available in El Paso County. And I know the State Health Department has talked about El Paso County's Operation House Call as a model that is working really well and getting information from us. So I think that they are doing phenomenal work. So with the partners who made Operation House Call a success, we have the Colorado Fire Department representatives here today, the Medical Reserve Corps volunteers, Community Advancing Public Safety Program volunteers, Matthews VU Medical Group, and former Fire Chief Ted Colas, who is a board member, and he's not with us today. As a reminder, Operation House Call was a collaborative endeavor requiring a team of at least 2 people, usually from the Colorado Springs Fire Department paramedics unit, paired with a Medical Reserve Corps volunteer or an El Paso County Public Health Administrative staff member who brought the COVID-19 vaccine to those who were homebound and could not access the vaccine any other way. This was a labor and time-intensive effort, and these teams were often out for 8 hours a day. The first teams went out February 24th, and as the end of August, they had provided outreach calls to 282 people and fully vaccinated 138 people, and continue to call more. And we couldn't have completed this outreach successfully without our dedicated community partners. I will now say a little bit about each individual partner agency. The Colorado Springs Fire Department. Here with us today is Lieutenant Brian Kurtz and Captain Don Watkins. If you would like to come up, please. Colorado Springs Fire Department was instrumental in the planning and executing these efforts. In addition to supplying paramedics to make the house calls, they've been tremendous. We've also like to thank Deputy Chief Jamie McConnellag, Captain Mike Archuleta, and Battalion Chief Joshua Bartlett, who oversaw scheduling, coordination, and deployment efforts among their staff. I also want to recognize former Chief Colas. When we had our vaccine consortium calls, if you all remember that attend that, he's the one that brought up the idea and then helped us to put the framework around. So his leadership when he was with the fire department, I think, was critical as well. So thank you both, and I'll go through one of actually, why don't, if you have something to say, and we'll go to another member, and then afterwards
real quick, yeah.
Then we'll take a photo, but I'll stop at each organization.
All right. No, so Don Watkins, thank you for having us today. I will just speak from my personal feelings about it. The first time that I sent paramedics out into the county, that's unusual for us, right? We are primarily city-centric and try to provide that level of service to the citizens. So I thought it was, I guess, to use the term, inspirational to see our group collaboratively, along with the Medical Reserve Corps, going out and serving the citizens of the county. And I'm a county resident, so that was something new for us. I think it's a model for the future, and I thank everyone for letting us be involved.
Thank you so much.
We have an award. How should we do that? Physical award. You want to present that?
So, sure. What I'm thinking is, since this was a collaborative effort, if we could present them at the last, and then we'll take a photo with everyone that sounds good?
Yep.
Okay. All right. Let's go ahead and have Rose Billis come up, please. She is with the Community Advancing Public Safety Program. She is here with us today to accept the award on behalf of the CAPS program. The CAPS program is a group of volunteers organized through the City of Colorado Springs. They engage in public safety partnerships with the city's police and fire departments and the Pikes Peak Regional Office of Emergency Management. These volunteers contributed over 483 hours, nearly 500 hours total volunteer time to this effort. They also called 110 people at least once, some up to 3 times to schedule vaccines from a list provided by Medicaid and the Resource Exchange. Some of them may be with us on Teams watching live. Rose, I'm not sure who might be on there, but if you are a member of the CAPS team, please raise your hand or speak up. We'd like to acknowledge you. We'd like to thank Lee Adams, Jane Anderson, Rose Billis, Kelsey Carter, Matthew Carter, Amanda Cliff, Sandra Cope, Brenda Gallegos, Robert Hadley, Joseph Hansen, Richard Hunt, Shannon Jansen, Jean Krautz, Philip Michelson, Donald Nelson, George Powell, Charles Silloway, Gail Smith, Aaron Springer, Tracy Stewart Bedburdick, Richard Whelan, Christina Wilsler, and Harry Yamamura. And this is only one effort that you all have been involved in, and we're so grateful for your work because I know that going to the vaccination sites and the large points of dispensing, the food and just the care that collaboration has been really great. So Rose, do you would like to say anything? And
I did a lot of the phone calls. It was very rewarding. I had a lot of comments. People who I called are very grateful that we offered this opportunity because they could not get out of their house. Mm-hmm. And we're afraid that without this, that they would have gotten COVID-19. So it was a very rewarding thing.
Well, and Rose, thank you too. This really speaks to the being proactive. And I know that some call to try to seek these services, but this really, was about going through lists and trying to be proactive to find people that were homebound and couldn't get out. So we're really grateful to you and the CAPS. All right, Matthews Vu, Dr. Vu, and you have, I believe, your wife, Stephanie Robbins.
No, site manager.
Oh, I'm sorry, what?
I work at the Woodman site office with Dr. Vu.
Okay, I apologize. I've never met your wife. So I should not assume, so I apologize. So Matthews Vu was a tremendous partner in preparing the vaccine for pickup by the Operation House Call teams. We notified Matthews Vu of the number of people who were scheduled for vaccination, and they ensured that we had vaccine ready to go when the Operation House Call teams arrived at their office in the morning. El Paso County Public Health helped with the paperwork, and Matthews Vu entered the data for each person who received vaccine. They were always pleasant and positive, so professional about participating in this program to reach homebound individuals. When El Paso County Public Health had our own vaccine to administer, we took over the preparation of vaccine for Operation House Call. Matthews Vu was an important and enthusiastic partner in ensuring the success of Operation House Call. And I also wanted to point out in 2020, we had mentioned in this at a previous Board of Health meeting, but we weren't able to provide our routine vaccinations. And Matthews Vu staff stepped in to collaborate with us to provide those vaccinations. So just all over it, it's a continuous type of partnership. We're recognizing Operation House Call today, but there's so many different efforts that we are involved in, and we would not be successful without you. And Dr. Vu or Stephanie, would you like to say something?
I can say something real quick. So I worked with these guys every single week. Seeing their bright faces when they come in was really nice, and their whole team was so respectful, and same with the medical reserves that joined them with their teams. We always try to have the vaccine prepared as soon as they arrive, so that way there was no delay in the time for them to get out to those patients that were homebound. So just a total rewarding collaborative that we did. The patients were grateful, the staff was so kind, and I looked forward to it was Wednesdays? Yeah, that they came in, so.
That's great.
Thank you, Stephanie. Stephanie was the person who
Thank you.
literally prepares the vaccine every week.
Yep.
So you were awesome.
Thank you.
Thank you. Can I say a few words? Is that okay?
Please.
All right, from time to time, I read these verses to our providers in our practice. And today I would like to read these verses to El Paso County Public Health. So, you are the light of the world. A city that is set on a hill cannot be hidden, nor do they light a lamp and put it under a basket, but put on a lampstand, and it gives light to all who are in the house. Let your light so shine before men that they may see your good works and glorify your Father in heaven. So thank you, El Paso County Public Health. Let your light so shine. Let the light that comes from above shine through you before men. Shine your light into our community, into El Paso County. Shine your light into a dark pandemic, a pandemic that is marked by death. It's marked by division in our community, that they may see your good works. We all see the good works that El Paso County Public Health has done by shining that light, that ray of hope in the darkness of the pandemic to provide the vaccines. The vaccines are gifts that come from above that gives a ray of hope in this pandemic. And we do all that to protect our community. We do all that to save lives. But I think that that is not the ultimate goal. We do that to save lives, to protect our community, so that our Father in heaven is glorified. So thank you, Susan. Thank you, El Paso County Public Health.
Thank you, Dr.
Recognitions to make that with those that are not with us beyond Ted Colas. We work continuously with the Medical Reserve Corps, and they have been here before. And so MRC is a national network of medical, public health, and other volunteers organized locally to improve the health and safety of communities. And they rode with the Colorado Springs Fire Department, paramedics to the homes of each individual to help administer vaccine and support the effort. So there are numerous team members that have been part of this effort. I also want to acknowledge our public health staff. Deanne Ryberg, my deputy director, has not let up. She served as the emergency center coordination director, which is coordinating, all of the different areas in public health response, which goes to the vaccine distribution and planning, and that is our health services director, Brenda Heimbach, as well as Christy Durbin. Carrie learned some of our nurses that were really important to the collaboration and helped out tremendously, and also our medical director, Dr. Robin Johnson, which is important when we're doing anything that is medical. And so I wanted to acknowledge that that team, you all together, has made tremendous strides and such a value to our community. So thank you so much, and let's acknowledge you. And keep up the great work. I don't know if anyone else has any comments, but I'd like board members that are here to step wherever Michelle tells us with our great partners and take a photo, and I will provide your public health champion star.
All right, good. These are the ones we have here. And board members, let's go ahead and join our public health heroes. Everybody.
Hey.
I just said Brian.
Shoot us from over there.
I really feel an old.
Great team.
I think we're friendly.
And Dr. Johnson?
And you retired right about when I was there.
Let's do this one.
Let's walk over here.
Okay.
Switch.
Yeah, as soon as I saw your name, I was like, I know that name, and I remember your retirement, so. Good to see you, sir.
Okay.
I'm always on the end.
Yeah. Okay.
Yeah, if you guys want to go first, I'm going to do it by group. So if you mind standing in the middle. Yeah, you're welcome. Maybe we'll kind of break it out like this. Get a couple. So if you guys will start, we'll do Matthew's Vu first. So Susan, if you want to come in next to Dr. Vu, I think we should be good.
You call it the ones we went to see. So.
No.
It's amazing how I do
All right, so everything should be good. So I'll snap with you. Yeah, let's do, we can get masks on.
Less than 15 minutes.
I'll make
We're
it
all
snappy.
vaccinated.
All right, ready? 1, 2, 3. Perfect, thank you. So Dr. Vu and Stephanie, I'll have you step out and then we'll swap in.
Board of Health member.
Yep.
Multiple.
Sorry.
That's right.
Sorry.
I know, it was, if we could have you, Dr.
Stand in the corner of the office.
Perfect, okay.
It's amazing.
And then your team's all good?
All right, I think we're good. Thank you, Rose.
Thank you.
Rose.
Thank you.
And then if you wouldn't mind stepping in the middle.
Oh, okay.
Sir, if you wouldn't mind coming in as well.
Firefighters in the middle.
I know, I was just thinking the same thing.
In the middle?
It's gonna be like a pyramid.
You got me in the middle
There with your colleague. We can
too.
do it. They're making the doctor signs these
Oh,
days.
no.
I know. Went to the store, police capture.
Do you guys both want to hold it?
That's where we work.
All right, we should be good. Ready? 1, 2, 3. All right, I think we are good. Thank you, everyone.
Thank you all. Please
Yeah, thank
tell
you.
Steve I said hello to
Absolutely
Bay
will.
and
Yeah,
thank
you.
everyone.
Well done.
who's been
Thank you. Thank you so much.
Thank you.
Thank
you
so much. How hard everybody worked there. It was like a well-oiled machine every time.
Yeah.
Thank you guys.
What's wrong with that?
Well done, sir.
Thank you.
That nice? Thank you, yes.
Usually through their agency, like home health.
Thank you. Good seeing you. Thank you, guys. Appreciate you.
We're headed the other way. Just because you can see my lipstick. You know what? Thanks for having my back. Oh, absolutely. Thanks for looking out. No, you can.
Oh.
That's special?
Sorry, Vicki. Oh, you're fine.
We'll catch fire chiefs and MRC at another time.
Yeah.
All right. Okay. Well, let's see. I think, we'll wait till Dr. Those in the virtual world, I hope you were able to see most or all of that. Any comments? Okay, thank you. Let's proceed with the director's report.
All right. I hope that we have, we're going to start off with a presentation within the COVID response and hear from one of our partners, Dr. Wendy Verhansel, and I hope that I'm getting your name right, the correct pronunciation. She is the superintendent with Harrison School District 2, and she is also the chair for the Pikes Peak Area Superintendents Association, which we work with her directly and then meet with a broader group of superintendents and school leaders. So Wendy, out of respect for your time, I wanted to have you speak first and with our board, and then Haley Zachary, who is our community disease program manager, is part of the schools team. and wanted her to provide an update around some data and all that we do with our collaboration. So Dr. Hansel, are you with us?
Yes, I am.
Okay, wonderful. Hello.
Welcome,
Thank
Doctor.
you. Thank you for having us. Just want to first of all thank the health department, El Paso County Health Department. Someone in our department, in our school, talks to them every day. They probably get sick of getting calls from our districts, but they answer every time we call regardless. And they're very helpful as we talk through certain COVID situations and problem solve and really trying to figure out how do we mitigate the risk but keep kids in school. And they really have worked to help us understand that that's our goal, is to keep kids in school, and how do we best do that. Just to share from the broad range of superintendents, about half of us right now are sitting with mandated mask orders coming from school districts, and about half are not. Those that aren't are trying to do some additional testing. So like Fountain Fort Carson does not have a mask order for their in-town schools, but they do increased testing. We meet a lot with the health department as a whole, probably more than they would like to, but just to kind of get on the same page and have the same message. And as the different rules and needs change, we meet to make sure that we're all interpreting it the same way, getting support from the health department. I think we're at a point where we're struggling just as leaders of school districts to see numbers going up or to see hospitalization numbers going up, and wanting to know how we do our part. Does that mean a mask order for K-12 education? Does that mean if you're a certain size, we need to do masks? I know in my own district, as soon as we went to masks, quarantines were pretty much gone. It's just the sick individual now that has to go home. And it really has helped our staffing as well as transmission amongst students. So we've seen positives from going to masks for sure. Some community members who are not happy about that. But in education, our goal is to keep kids in school. So regardless of the debate of do masks work or not, we're not going to get into that debate. We're really about how do we keep kids in school, and for us right now it's keeping them in masks to make sure that they can be there and get their education. When we had to pull them out of school last year, it was very detrimental on so many levels. And so we're feeling really positive right now that if everyone's masked, we can keep people in school, unless of course they're positive, but that's 1 or 2 people here or there. So that's just kind of a report of where we are. We meet with the health department all the time, very supportive. And I really feel like if there's a silver lining in this pandemic, it's been the partnership that we've formed with the health department and making sure that we do our part to keep the community safe, keep hospital beds open for those who need them. And we just really want to know what's the next step schools can do to help partner with the health department of making sure we help keep the community safe.
Thank you, Dr. Hensel, for taking the time to join us and provide that feedback. I do want to say that, I commend Dr. Hansel on her leadership in following public health recommendations of instituting a mask requirement. And I know that Harrison School District 2 did that early in September. And we are seeing within the school districts that have implemented a mask requirement that there are fewer outbreaks. And when 2 kids are masked and there's one exposed confirmed case, if 2 of the kids are masked, the one that is exposed does not have to quarantine. So there, for the shared goal with public health and also school districts of maintaining and keeping kids in school, the purpose of wearing a mask also is to reduce the infections that are spread, but it also has an impact on reducing quarantines, who has to quarantine. And so I know that that's a major priority of some of the schools, and that's what we're seeing through some initial data that we have. And Haley will go into that a little bit more, and we will get into the hospitalizations around the demographics and specifically the ages for the kids that the pediatrics ages 19 years and younger. We run about, anywhere from like maybe 2 to 7% of hospitalizations. So they are not the burden on the hospital for the COVID cases. I do know that Children's Hospital has announced, and we work closely with them, that there's a tremendous concern for RSV that has started earlier and taking up the hospital beds. But we'll get into some of the burden of the hospital later in our data update. I just so appreciate Wendy's leadership as the chair of the Pikes Peak Area Superintendents, and also being solution oriented and really working with us through a lot of difficulties and a lot of challenges to navigate through these times. And I just can't say enough about your leadership and just the collaboration that you working with us. So thank you. Appreciate that. And you're welcome to stay on. And Haley's going to go into specifics around what are we seeing in the community, and some data detail, and then we'll go into some other data reports as well. And please feel free to ask any questions at any point in time for any clarification.
Thank you.
Morning, everyone.
A little bit low.
Speak up. Yep.
How about now?
Better.
Getting better, Haley.
Speak right up, Haley, please.
All right. So currently what we are seeing within El Paso County is we have 31 confirmed outbreaks within our school population. This does not include the 18 suspect outbreaks that we are tracking. All in all, these 31 outbreaks are composed of 900 cases that are associated with schools. So we are looking at a very large increase in outbreak sizes from what we have seen the previous year. A little bit about the work that we're currently doing with our schools. Our team, which is composed of 7 individuals, so 4 epidemiologists, a supervisor, and 2 disease intervention specialists, respond to anywhere between 20 and 30 calls from school nurses every day. Each of those calls takes around 30 minutes, if not more. And then after that, a thorough summary is actually developed and sent to the school so that we can ensure that the information is being conveyed accurately and understood, and have that dialogue not only over the phone, but also in writing. And that allows school nurses to share that information with amongst their administrative staff, as well as with any others who are involved in that process. On average, we also have 40 school-related COVID-19 cases reported every day through case investigation and contact tracing. So our team has our hands full with really all of the information that is moving through our systems, and ensuring that every single one of those cases is in turn reported back to the school so that we are able to provide isolation and quarantine recommendations appropriately. Public Health also assists the schools with quarantine notifications if needed. So a school has the option to either do their own contact tracing and identification within a school, or they can do that contact tracing and relay that information back to the health department, who will then call those individuals and place them in quarantine. And then schools also report additional cases to Public Health if they receive that information prior to Public Health receiving it. So there's a lot of communication channels that we have going, and this is something that's happening 24/7. So we do have a on-call phone that is staffed by a communicable disease epidemiologist as well as a COVID-specific epidemiologist, and they carry a phone with them 24/7 in order to get those calls on, evenings or on weekends. We've also returned to staffing a weekend day specifically for schools. So on a Saturday or a Sunday, every single week, we have one individual dedicated to just working through school stuff to ensure that if there's anything that needs to be addressed prior to the next school week, we are able to assist the school with that process. Next slide, please.
Question? Yes.
Haley, I wanted to say something before you go to the next slide. I wanted to commend the schools that are doing the contact tracing, and COVID is dominating a lot of their time, and it's very time intensive with the contact tracing. the schools that are doing the contact tracing, you know, they have good relationships with their school community and their kids, and they are also able to narrow in the mitigation areas, and then that means that there's a narrower scope for quarantine as it relates to exposure. So that's what we're seeing too. If we're able to narrow in and get some of that detail, which the schools are, the nurses and the staff, I mean, they're doing a really great job. And I know that this is heavy work when Haley talks about our staffing and that we've ramped up. As you heard from Lori Cleaton and some of the underspending as it relates to some of our staffing and being stretched. We are very stretched, and our communicable disease staff is very stretched, and we do have vacancies and trying to surge up and maintain staff and train staff. That it's a lot to undertake. So there's a lot of components that you know we don't always talk about, but I do want to share for the board's awareness around some of the challenges that are not talked about, and that you know our staff and the schools they're doing the best that they can, but the staffing is stretched. I believe on the school side as well as the I know on our public health team. So thank you, Haley. I just wanted to point that out.
Thanks, Susan.
I have a question. Yeah, question?
Haley, what about staff? Are you seeing any cases among the staff in the schools or in the districts compared to children?
Yeah, so this 900 cases is composed of both students and staff. I will say that the majority are students, but we are also seeing an increase in staff and adult cases as well. So they're both included in that number. And I don't believe it's broken down, but we are certainly tracking those as well and seeing an increase in both of those.
Thank you.
Sure.
Question? Yes.
Is there a do they quarantine the staff like they do the students?
So both students and staff, there's a few different factors that can exempt an individual from quarantine. So as Susan was mentioning previously, if both the exposed person and the infectious person are masked in a traditional classroom setting, quarantine is not required. You can also be exempt from quarantine if you were vaccinated or if you have had a positive case within the a positive test within the previous 90 days. There are a few other ways that an individual can be exempt from quarantine that I can't remember off the top of my head, but our county does not fit into those criteria at this point in time. So one of them is a serial testing program within the school. And another is having low transmission within the county under a certain number of cases per 100,000, which would also allow for the exemption from quarantine.
That'd be 35 cases per 100,000 would be the exemption. And then also the other area for exemption is if a school is able to demonstrate 80% vaccination coverage, or the community has 80% vaccination coverage, and the guidance changed, I think it was a little bit over a week ago. So that's another area that we continue to keep in touch with our school partners, because some of what does come from the state, we work together to try to figure out, you know, what is required, but then also what is realistic as it relates to being able to implement, given some of the staffing models and just the workability of that. And we'll talk about vaccination later, but as you know, that El Paso County has one of the lowest vaccination rates among the top 10 most populated counties in Colorado. Yeah. We're making progress, got a lot of work to do, but we're not where we'd like to be.
Let me just feedback for clarification. If our county reached the 80% vaccinated level, we could avoid in large part quarantine and keep those kids in school?
That's my understanding.
Okay, all right. Yes, Dr. Vu.
Haley, can I clarify the quarantine and isolation protocol for staff and teachers in school is the same as for students, is that correct?
Yes, sir.
Okay, great. You want to continue?
Next slide, please. So this slide is just to demonstrate that there's some pretty significant differences from last year and this year. On the left, we have Colorado State data regarding outbreaks. That kind of plum color is this year, and the yellow is last year. And so what we're seeing is, although the environment's different, that with the Delta variant, in addition to some of the changes in requirements for schools and mitigation strategies that we're implementing, we're seeing a significant increase in outbreaks a lot sooner in the school year as opposed to last year. Again, there are some caveats. So last year, schools, at least in El Paso County, staggered kind of their start dates. So they came to school a little later and took things a little slower. But we also changed the outbreak definition, which was initially 2 cases that were epi-linked would be cause to begin an outbreak. This year it's 5. And so as you can see, we already have a large number of schools that, despite making it more difficult to identify an outbreak, we're having a larger number of them. On the right is El Paso County specific data about school outbreak associated cases. And on the left is the month of August, and the right is the month of September. And as you can see, that really low bar is last year, and the higher ones are this year. So each outbreak is involving a larger number of students, and we're seeing a larger number of students becoming ill and being identified as cases as opposed to last year.
Haley, I'd say that there's a lot of variables that go into that. We know that we had restrictions and, whether it was on businesses and really restrictions on mobility, different schools and hybrid models or not in-person learning. So there's many factors to take into account, and especially the Delta variant that is much more contagious and easier to easily spread. So here's the data, but just know that there's a lot to unpack here. I think the point is that, we are seeing, increases in some of the numbers, and we'll get to it later, but, the light at the end of the tunnel also, I always look for hope, is that the 5 to 11-year-olds also will have an approved vaccine here. So have to look for what is the remedy also to prevent and combat, adapt in the COVID response. So thank you, Haley.
Thanks. Next slide. So throughout all of this, as Dr. Bernhansel mentioned, routine collaboration with our school partners has been imperative, and we wouldn't have been able to make the impact that we have without our partnership with them. We have a wonderful group of school nurses that my team is very dedicated to, and I feel that they are very dedicated to us, as well as COVID coordinators who we work with and the Pikes Peak Area Superintendents Association. And so we have a very robust conversation with each one of those groups and are very much in contact with them at least once a day, if not multiple times per day. So we do host monthly meetings with both the COVID coordinators and the school nurses to convey any changes in our recommendations, and we'll host those more frequently on an as-needed basis, but also so that we can hear from them about what their concerns are, what's working within the school, what is not, and how we can maybe help work with them through those sticking points. And through that, we're constantly kind of reassessing our response and ensuring that we are shoring up areas where we can help. So we've created an electronic case reporting tool so that schools can just go into that link and report cases to us. They don't need to call us and leave us a message. They can just report directly in through there. It is HIPAA compliant, and then we are able to take that information and either work through the school, but they are also able to indicate in there what they need from us, if anything, and what they've already done for that case's behalf. So we're really able to cut down on the amount of communication to ensure that we're being as concise and effective as possible. And then again, when we are notified of a case through case investigation or contact tracing, we send emails to the school 3 times per day with that information so that they are aware of those cases and able to take action within their schools. Again, we provide schools with relevant outbreak data and any guidance that they need in order to do their job effectively. And those 20 to 30 calls that we get per day are typically school nurses calling us, asking us about specific scenarios that we can then help guide them in their efforts and provide some technical expertise. Our communications team and our data analytics team have been phenomenal in creating a weekly children and youth data brief, which is hyper-focused on local data regarding youth and school-related issues that we then send out to our school partners so that they are able to keep on top of a lot of those issues and also have that reminder and an outlet on how they can talk to us and let us know if they have any specific topics that they're interested in hearing about. Next slide. There are also some great state resources that are available to schools this year. So the Colorado Department of Public Health and Environment has created a serial testing program specifically for schools. It is an opt-in program that schools can enroll in at this link. At this current point in time, we have 2 schools who are fully enrolled in that program, and we know that a lot more are in the process. But it was just rolled out, I believe, a couple weeks ago, and so we're eager to hear how that's working for these schools and how it is working to keep kids in school. And then in addition to that, the governor has reinitiated the school masking program, which is again an opt-in program where schools can receive masks for both their students and staff to ensure that we are focusing on keeping kids in school. Again, noting that if both parties are masked, they would be exempt from quarantine. Next slide. And so lastly, just some trends that we're seeing in terms of case investigation, contact tracing, and outbreaks. We are seeing an increase in a general reluctance on behalf of the public to work with public health. Again, not our schools. Our schools are phenomenal in terms of cooperating and working with us. That being said, a lot of parents are shying away from that, as is the general population. And so we are seeing a decrease in the amount of cases who are willing and able to fully participate in that process. Many of our cases are more willing to complete a survey form of the case investigation rather than speak with an actual case investigator, which, although that's a helpful option, often people are more able to participate through motivational interviewing skills as opposed to a self-survey. Because of the current surge in cases that our team is experiencing, we are working on a prioritization schema. So minors and school-age children are considered a priority for our CICT program. But all of our cases are still contacted at least twice, and they are also offered that isolation and quarantine information, as well as an interview if they choose to partake in that later in time. For most of the outbreaks we are seeing, we continue to see that the majority of the cases are unvaccinated. We are seeing fewer breakthrough cases, but they tend to have less severe symptoms, and they often don't result in hospitalization or death. But it's still very common for our cases to report to work or school with symptoms. And so that's something that we continue to really work with our population to stop is, going into the workplace or going into school while you were actively ill. We still hear, well, I thought I had, and that's still a very common misinterpretation of those symptoms. And so people are going and then find out a few days later that they actually have COVID-19 and have been infectious while in the workplace. For facility trends in general, we're seeing that those who opt to close for at least a week at the beginning of their outbreak are resolving their outbreaks a lot sooner than facilities that choose not to. We're also identifying that the majority of outbreak facilities are not masking or requiring any type of physical distance. And then specific to schools, we're knowing that schools that are implementing a lot of those layered prevention measures Their outbreaks are tending to be less often and a lot smaller than those who are unable or are not implementing some of those layered techniques and those layered prevention measures that we are recommending schools to utilize. And I believe that's my last slide, but I'm happy to take any questions or concerns.
Sure, and I'll let me just say a few more things and then we'll take some questions. I wanted to clarify, Dr. Tierbush, I was wrong. It's 80% vaccination status within the schools, not the community.
Okay.
So 80% vaccination rates in El Paso County will not prevent quarantines. So I wanted to make sure that we're clear on that.
Well, it puts even more pressure on getting the vaccination to the younger school children.
Yeah, and we'll talk about this later with Brenda Heimbach, but we do have a mobile vaccination van. We purchased one and we just launched it last week. So we're able to increase our bandwidth with NAMI and some of the mobile vaccinations that we're doing with the schools. I think the most recent one that we did with a school was District 49, and we have something set up with Boo to the Flu for District 49 as well, and so we're making continued progress on that area. So I did want to say that. And then for awareness within our school districts, and every school is unique depending on what their staffing models are, their setup and ability to do the layered prevention measures. And I think it's really important that it's not pulling one prevention measure out of all of the multiple prevention recommendations that we have. It's a blending, and it's doing those prevention measures together. We're for awareness with the school districts, the larger school districts that have implemented a mask requirement. Districts 14, which is in Manitou, districts 12, District 3, District 2, District 11. District 20 has 2 sites on the Air Force Academy, Air Academy High School, as well as I think it's another middle school that because it's on a federal facility, they are required to wear masks. And then also with District 8, which is Fountain Fort Carson, does have some limited federal schools that they're on the federal property, so they have some mask requirements. So I did want to provide that awareness because it's there are schools that we've worked with that are following public health recommendations, not only CDC, state, but also local recommendations. And we're here to provide technical support and here to help implement and provide resources, such as Haley said, the governor provides free face coverings, free testing, all of those things. But again, are there the staffing models also for the logistics of the testing? I mean, so there's a lot to consider here, but I did want to say that. And we'll take any questions, and then we will move into new preventative actions that our community is taking, and then we'll go into general data updates, and then also monoclonal antibodies also later on the presentation, because the COVID response still continues to be intense as we adapt to the needs and the changes as to where we are with the response.
Okay. It sounds like a lot of information yet to come.
Yeah.
Any Board of Health member comments or questions? Yes.
I do. I'd just like to thank Dr. Burke-Hansel for her courage to require masking in her school district. So thank you so much. It means a lot. And it does take courage, especially when you have parents and people that aren't supporting that. So hopefully you've weathered that well, and congratulations and thank you. And a question for Haley about breakthrough cases. Do you know if those were for fully vaccinated people, or was it people that only received one vaccination?
Sure. To be considered a breakthrough case, you have to be fully vaccinated. So that would be people who are 2 weeks past that second dose of vaccine if it's a 2-dose series.
Thank you.
Okay, any other questions, comments from Board of Health members? If not,
Dr. Berhansel, do you have anything before we move on to the data?
I can just share some anecdotal data of what a mask mandate meant for our district. So prior to Labor Day, we started the school year with no masks. Masks were highly encouraged, as we hear from everyone. And we honestly, when I walked in a classroom, maybe out of a class of 20, 2 to 3 kids had masks on, and maybe the staff, maybe not. And we were seeing in the 2 weeks prior to Labor Day about 600 to 700 students and staff having to be isolated because of exposure. We put mask mandate in Labor Day, and since then we've had maybe 20. So for us, a mask mandate has been huge and has really meant that school can be as normal as possible, both from the student perspective and from the staff perspective. So just not having to send people home just because of exposure has been huge. And so for us, a mask mandate made that major switch, and school is as normal as it can be at this point.
Thank you, Doctor.
Thank you, Dr. Hemesel. I think that emphasizes just reduced quarantine and the shared goal of keeping kids in school. So I think that that's what we are seeing with the data generally with the schools that have implemented the mask requirement. Thank you, Haley, for the presentation. I'm going to go into what new. So I think it's important that we share what's new, preventative actions that are impacting our community. We continually talk about all of the prevention tools that we have available to us: vaccine, social distancing, masks, increased ventilation, and staying home when you're sick. And not everybody is following those recommendations, but the more and more that we get with those layer prevention, it is really going to have an impact on organizations and the community. So with that being said, we continue to work with our federal and state and local partners to expand critical access to resources. And that's where we spend a lot of our time to provide easily accessible resources and also education and recommendations, and working with our partners to collaborate to help with successful implementation throughout our community with the prevention measures that we know that are effective. So more than 30 providers we currently have, and about 100 locations offering COVID vaccines throughout El Paso County. We have 2 high-volume community-based sites through both the COVID vaccine and testing sites, Chapel Hills and Citadel Mall. We'll talk a little bit later how we're gearing up for the booster shots, and then also the availability of the 5 to 11-year-old vaccines. Vaccination sites preparing to ramp up, to meet that demand as it relates to some of the mandates that I'm going to talk about, both on the federal level that has an impact in El Paso County, as well as the state level. So on the federal level, we know that President Biden has issued a mandate for federal workers and employees of contractors that do business with federal government, and employers with 100 or more employees must be either fully vaccinated or get tested. So if they do not want to get a vaccination, they have the option to do testing. And I know that a lot has been talked about around the mandate and vaccinating, but I think it's really important to point out too that there's also an option to get tested for those that do not want to get vaccinated. Work is in the healthcare center facilities that receive Medicare and Medicaid reimbursements, including hospitals and home health agencies, will also have to be fully vaccinated. The Department of Human Services will require vaccinations for Head Start programs, as well as schools run by the Department of Defense and the Bureau of Indian Education. And I know that on the federal level, our community has a significant number of military as well as contractors. And some of the numbers that I try to put together with my team, and we'll refine these as it relates to what do we have going on in our community. According to DOLA estimates, federal, military plus contractors are more than 50,000 in El Paso County. Health services, including ambulance, hospital, nursing, and residential facilities, about 41,000. And we are awaiting OSHA's directives on what the requirements will be to impact federal workers and businesses that will have the obligation and the requirement by law to follow these vaccination or testing mandates. The deadline for the federal employees to be fully vaccinated is by November 22nd. And further guidance is anticipated on September 24th on any requirements or exceptions. And so what our role is here locally in public health, and that my team is focusing on in the COVID response, is to make sure that we can meet the demand, that we have the resources, and they are easily accessible in all parts of El Paso County to be able to get their needs, their obligation taken care of, depending on where they're employed, and also working with our primary care physicians, and we have a vast vaccine consortium, and Dr. Vu, you're one of those, and I'm sure that you're keeping up to speed and ramping up, but we also are in the planning always of those efforts. So with the state mandate, the Colorado State Board of Health mandated vaccines for all healthcare workers in licensed healthcare settings, including employees and direct contractor support staff. There's a lot of detail on what I'm sharing, so I'm really breaking it down, but who is defined as a healthcare worker for the state mandate, and they will, they're in a process of taking feedback that will be presented to the State Board of Health, and so it will go forth into a rule to be official with that, and I believe that that's probably mid October, and I'll ask our attorney Diana to chime in. But a healthcare facilities licensed by the Colorado Department of Public Health and Environment, including acute treatment units, ambulatory surgical centers, assisted living residents, behavioral health entities, birth centers, community clinics, community mental health centers, dialysis treatment centers, freestanding healthcare agencies, hospice, hospitals, general rehabilitation, and psychiatric facilities for individuals with intellectual and developmental disabilities, and nursing homes. The regulation does not apply to individuals, providers, or other types of facilities not regulated by the Colorado Department of Health and Environment, such as individual doctors' offices, standalone pharmacies, urgent care centers. So there's a little bit there, clarifiers, and we'll see what the rule amounts to when it becomes official. And Diana, do you have anything to add to that really brief overview of many pages of information on some of the preventative actions that we're stepping up, being the resource for the implementation of these mandates?
Just a few comments, if I could, please. Good morning, everybody. Diana May, County Attorney. First of all, the requirements or the mandates are from the federal government, and they are from the state. They're not from the county, and they're obviously not from El Paso County Public Health. So I just wanted to make sure that that's abundantly clear. And then part of the, I think you've covered it perfectly. Part of the issue is we don't know what the final rules are going to look like, so it's hard to know exactly what the requirements are going to be without knowing what the mandate final language is going to be. So once we get that additional information and get everything finalized by the federal government and the state on what's required, we will provide that additional information to the board. And I know Susan will do a good job at communicating that out to our partner agencies also.
Mm-hmm. And for the state mandate, the first dose of vaccine is by September 30th. Deadline for full vaccination is October 31st. So I would say that things are moving very quickly. And again, we're constantly planning and ramping up to be able to have the resources to meet the demands as they come about, if they're mandates. And also, Brenda's going to talk about how we're ramping up for the boosters, and that we are going to focus in on the nursing homes and long-term care facilities. But there's a number of activities that are new and that are stepped up preventative actions beyond what we have been doing as we continue to adapt and be flexible and to meet the needs at different points in time as the COVID response evolves. So with that, if there are no further questions about the mandates or comments, we will move into our activities to increase vaccination rates in El Paso County.
Hello, good morning. I'm Brenda Heimbach, the Health Services Division Director. And El Paso County Public Health continues to engage in multiple activities to increase vaccination rates in our county. This includes outreach to schools, businesses, nonprofits, and churches, offering mobile vaccination clinics to those organizations. We also are continuing to do outreach to behavioral health hospitals and long-term care facilities for residents and staff to offer vaccination. For some time, we've been coordinating with these groups that they can come to public health and pick up vaccine for their residents and staff. And so we will continue to offer that service for facilities that do have sufficient nursing staff on board. And then those two are trusted providers with the vaccine, which is very helpful for people being more receptive to having a vaccine. Operation House Calls that we honored today continues to go forward, vaccinating homebound individuals. In fact, a team is going out this morning with CSFD and also an immunizations clinic staff member to vaccinate 4 people who are homebound. We're continuing monthly vaccination clinics at our new building in Fountain. The next one will be October the 5th, offering Pfizer vaccine, and that clinic is available for people to register right now on our website. We offer vaccines weekly at the jail. We're promoting vaccination within the public health programs such as WIC, family planning, and so forth. We do provide the COVID vaccine at our clinic here on Garden of the Gods on a regular basis, in addition to flu vaccine and all of the regular vaccines that people need to prevent disease. We're working with community providers to offer flu vaccine when they're also offering the COVID-19 vaccine. So as Susan mentioned, there are over 100 locations in our county who is offering COVID vaccine, and we're encouraging many providers to offer flu vaccine at that same time as we're heading into influenza season. And then our communications team is working on social media and our website to consistently promote vaccine and accurate information about the vaccine. And they've also put together some toolkits that they have sent out to businesses and schools that are helpful in providing more information about vaccination as well. Next slide, please. We're very excited to have our new van, our mobile outreach van. Picture here, more clearly identifiable when we are out in the community as to where the vaccine clinic is located, and all of our supplies can be organized in one place. We had been doing some mobile vaccine clinics prior to receiving the van, and this will just make that work so much easier for our team. Last weekend, we launched the van officially. We did 2 vaccination outreach clinics, one on Friday at Vista Ridge High School, and the other was on Saturday in Bear Creek Park for the Homefront Military Network's Healthy Together Week events. Between the 2 events, we vaccinated almost 60 people, which was a very nice outcome. This van is just one of the ways that we're trying to increase access to the vaccine, ease of getting a vaccination, as we can be in multiple places in the community. Requesting the van is simple. People can call us or they can email us here at healthinfo@elpasoco.com, and we will get back with them on coordinating a vaccination clinic at their location. Next slide, please. We've all been hearing a lot about COVID booster doses or the third doses in the media. On Friday, most of us are aware that the FDA did recommend booster doses for people aged 65 and older, and also workers in high-risk occupations such as healthcare. Today and tomorrow, CDC's Advisory Committee on Immunization Practices, or ACIP, are going to meet to discuss the research and will hopefully vote on authorizing these third doses for that select higher risk population. We have done a significant amount of outreach to long-term care facilities. There are over 60 in our area. Our immunizations clinic previously worked closely with them with Outbreaks last year and this year, and now have been reaching out to help them formulate a plan for how they're going to provide vaccines for their residents, whether that's a first, second, or a third dose, as the third doses are officially authorized. And this is important, as we know, originally with Operation Warp Speed, national pharmacies were contracted to provide all of these vaccines in the long-term care facilities, and that's not currently the case. So each facility needs to have a plan for protecting their residents and staff. So we're helping them coordinate that. Our mobile outreach team is available to assist with first, second, and third doses. Some of the facilities are choosing to work with some of the same national pharmacies that helped last time on more of an individual basis, where they're going to come in as well and provide vaccines. So there's multiple options for these facilities to be able to protect their residents and staff. Our immunizations team has also been working with community providers, different physician groups, reaching out, encouraging them to enroll as COVID-19 vaccine providers if they've not already done so. Again, just more portals of access to the vaccine, really important, and especially trusted providers. People do have a lot more choices now about where they could get their vaccine, and so we just want to make that as easy for people as possible. The Colorado Department of Public Health and Environment did conduct a survey of providers throughout the state, and their conclusion was that they do not believe they need to reactivate all of the mass vaccination sites. There were 6 of them throughout the state that could vaccinate 3,000 and more people a day. They feel like the provider network is now broad enough and dispersed more equitably throughout counties that they don't need to do that any longer. However, in a few minutes, Lisa Powell will be talking about some plans. There are 4 sites in Colorado, including El Paso County, that will have some increased capacity September 20th through the 30th to deal with some of the mandates. So Lisa will talk a little bit more about that. Next slide, please. We are also planning for the authorization of Pfizer for children aged 5 and 11. It's anticipated that Pfizer will submit their application to be able to vaccinate this age group by the end of September. And the Advisory Committee on Immunization Practices at CDC potentially could approve that as early as the end of October. The doses are likely to be smaller. We're hearing it's about 1/3 of the adult dose. So really important for folks to wait for formal authorization to vaccinate their younger children to make sure that the dose is appropriate for that age group. So looking forward to hearing more about that as the information goes to the Advisory Committee and FDA here in the near future. Public Health Immunizations Clinic is reaching out to pediatrician offices, again, trying to encourage them to enroll as COVID-19 vaccine providers if they have not already done so. Just yet another trusted provider. Families tend to be comfortable with their pediatricians and what they advise, and so hoping to have more ease of access for these younger folks. And then our mobile outreach team can also provide vaccination in schools with parental consent consistent with Colorado law. Our team loves working with children, so looking forward to that opportunity as well when we go forward. Are there any questions or comments before we move on to Lisa Powell?
Dr. Booth?
Can I have a comment? I think it is very exciting regarding Pfizer vaccine for 5 to 11, and if and when it is authorized, I agree. In addition to points of dispensing, primary care pediatrics practices giving the vaccines, sending mobile vaccine units to the schools. A concept in my mind is perhaps we can also empower the school nurses to give the vaccines in the schools, since those school nurses are there every day, Monday to Friday. So that's a concept that I have in my mind, is to allow those school nurses to give vaccines to the students. I know there are barriers with that, there are regulatory barriers, but if we can lower some of those barriers, I think that might be a good concept.
That's an excellent point, because school nurses are very trusted providers as well, and they're very important in all of this. We work very closely with the District 49 school nurses when we do our Boo to the Flu annual event. They're just a wonderful team that we enjoy working with, and we would be very open to discussing the ability to do that. We have the safe vaccine transportation units that we use currently with the long-term care facilities and the behavioral health hospitals. So we would be open to having that discussion. That's a very good idea.
Thank you.
I wanted to echo that's a fantastic idea. As I mentioned earlier, that we're very stretched. We've got, I think, 4 or 5 vacancies for public health nurses and a nurse practitioner. And so we're able to make progress when we work with partners to really kind of extend when we work together to accomplish the mission. And I know that there are other organizations that are having challenges hiring nurses and healthcare staff, and we are no different. So Brenda and her team and nurses, I mean, they're working tremendously hard, and they are very stretched. So anytime we can increase that bandwidth, I think it's good. We also did write some LPN job descriptions to see if we could maybe hire, at some LPNs to help us out with some of the vaccination. We're trying everything that we can. We're, contacting contracting services for nurses, but there's so much competition also for the nursing staff that it's just a challenge. But I just wanted to say that concept model is certainly what we want to work with the schools and anyone to, however we can increase our bandwidth and do it appropriately, with safety and following Colorado law as it relates to the procedures and such. We want to do. So thank you for that comment. Brenda, thank you. We'll move on to Lisa. I did want to let you all know that we're not focusing today, but we do have a congregate settings team, much like we do a schools team. We have various different collaborations and teams. So when we talk about vaccinating within the jail and instituting different prevention measures, they're working within in that arena, our communicable disease epidemiologist, but then also Brenda and her team, they're planning, and also with long-term care facilities, because we know that that's an area that needs some attention. So that's a whole nother effort that we haven't talked about. There's so much, but did want to acknowledge that there are teams there also. Did you have something to say?
I was just going to say, I just want to shout out about we have teams in that long-term care for our homeless as well.
Yes.
Another congregate setting.
Yes, homeless. I mean, there's a number of different teams and collaborations that are going on, and maybe at next board meeting we can focus in on the activities that are going on there. So with that being said, as I mentioned, that there are we're preparing and we're ramping up to meet some increased demand. Lisa, you want to talk about some of the high volume testing sites as well as the vaccination sites, please?
Yeah, sure. Thank you so much, Susan. So as Brenda already mentioned, we are preparing to expand our capability at the Chapel Hills and Citadel sites. The state of Colorado did authorize some of the larger community testing sites, or vaccine sites in the state, 4 of them. 3 of them were in the Denver area, so we're really pleased that El Paso County was chosen as one of those sites to expand. and we'll be able to increase the amount of vaccine available in our community and the ability to get that vaccine out through our Chapel Hills drive-through site, as well as the Citadel site. And it has worked really well in the last couple of months since we were able to co-locate both testing and vaccine at the Citadel and Chapel Hills parking lots and have drive-through for both of those activities in those areas. Additionally, we continue to have clinics at our El Paso County Public Health South building, and the building is still in a position to be able to expand and contract as we need based on demand. So we are doing planning right now for the potential of an increased demand for both boosters as well as that 5 to 11 age range. And then lastly, we continue to work with our vaccine consortium to give situation awareness in regards to vaccine readiness for these boosters and the 5 to 11 amongst all of our community partners. And that's all I have. Thank you.
Thank you, Lisa. And let's go to Fadi Yokohana, who is our epidemiologist, and we are going to do a general update with cases, hospitalization, deaths, and some demographics of what we're seeing in the community.
Take it away, Funny.
Hello and good morning. Can you hear me?
Yes.
Yeah.
Perfect. Before going on into the visuals that we have today, I just want to give a brief high-level bullet point highlights. We are at 277 per 100,000 on our incidence. So we're pretty far away from that 35 that was referenced in our conversation. Some good news there, though. For the last 5 days, we have seen a decrease in that incidence. We did peak last Wednesday, and hopefully by the next time we meet, that will become a pattern and we will drive that incidence down. Bad news is that our positivity did hit an all-year high, and we're noticing a bit of a delay between the two at the moment. We are at 61.5% fully vaccinated of our eligible population. When Pfizer becomes and other vaccines become eligible for the younger kiddos, we'll adjust our denominator, and you'll see that percentage decrease momentarily as the denominator grows. When it comes to vaccinated with one dose, we're about 67 to 68%. We are seeing 400 to about 600 new people get vaccinated every day, which is exciting. It is a consistent volume for the past 90 to 120 days. We predict that the military, federal-based, as well as the employee-based mandates or recommendations will not result in a huge spike. It will likely just feed that consistent wave that we're seeing. Typically with a vaccine campaign, you see a spike and the vaccine campaign is concluded. Now we're seeing an elongated, consistent wave of new people get vaccinated. Next slide, please. This is a graph that we're showing on the screen now. It just describes the consistent rise in the positivity. We did reach last night the 10% mark, and like I said before, we did hit an all-year high in 2021. The number of tests that are being reported has increased in August compared to July and June. And September, while not finished yet, it is trending to be higher than August. Next slide, please. The graph that we're showing now describes the distribution of the ages among our fatalities. We are averaging about 1.4 deaths per day across the year. That varies month to month. Most recently, August is at 1.4, September is at 1.6, but the overall average for 2021 is that we're having 1.4 deaths a day. The age demographics have trended younger. We started off early in January at about almost 90% of deaths among the 60 or older cohort. As more and more of those folks got vaccinated, the demographic of deaths shifted to the 40 to 59. The 0 to 19 and 20 to 39 continue to be a very small percentage of our deaths. The 60 and above are hovering around 70, 75%, and that 40 to 59 is starting to take more and more share of the demographics of deaths. And this is only El Paso County residents. Next slide, please. Continuing with only El Paso County residents, we're now looking at the same graph schematics, but when it comes to hospital admissions. Perhaps a visually, a large change you can see on the screen is that early in January, more than half of, almost 60% of hospital admissions were among the 60 and above. And again, we see that trend younger. The 40 to 59, again, are starting to take more share of the hospital admissions in El Paso County. The 0 to 19 continue to be around 5 to 7%. And the 20 to 39 saw a bit of an increase, but generally the largest increase is going through the 40 to 59. Important to note here that in September and August, we are averaging about 11 to 12 admissions per day. And that's higher, almost twice as many as June and July. And again, these are only El Paso County residents. Next slide, please. What we're showing now is something that we've seen consistently through the state data as well as national data. Majority of our hospital admissions are among folks that are not fully vaccinated. The percentage has shifted between 5 to 15%. You can see on the graph here, these are raw counts. The red line are folks that are admitted to the hospital. They're El Paso County residents and they're not fully vaccinated. The smaller lower line, the blue line, are folks that are fully vaccinated that have been admitted to the hospital. The very right hand of the graph may seem like it is a downward trend, but that's just because September is not yet complete. So those numbers are partial. And with that, I'll pass it on to Dr. Johnson.
I have a question for you, Claudia, if I can. So when the 5 to 11-year-olds start getting vaccinated, can you also report that separately? If you want to do it in aggregate form with everybody, it'd just be interesting, I think, to see how many 5 to 11-year-olds are getting vaccinated. Is that something you can do?
Yes, we'll break that down on our dashboard like we did for the 12 to 17 to track that cohort itself and how it vaccinates over time.
Yeah. Thank you.
And have this at the top of your recollection, but El Paso County 5 to 11-year-olds, is it about 60,000 or what is in El Paso County?
Give me 5 seconds, I'll pull that up.
Just for kind of some more context.
66,000, 5 to 11.
Okay.
They're a pretty large group. I mean,
We have
just
some young
given.
kids.
Yeah.
Funny, I had a question too, if I could. In the death data, you mentioned that younger group is 0 to 19. Is there any way we could drill down on the 0 to 5, the number of deaths in El Paso County and the 0 to 5-year-olds?
We don't have any deaths in the 0 to 5-year-olds. We have in 2020 deaths in the 10 to 19. It's one of them is a 19-year-old and the other two are 16-year-olds.
Okay, thank you.
And just to quickly mention here, Susan, if I could, one of the exciting things that we've started since the last Board of Health meeting is our communication department, Dr. Johnson and our office have started to add to our website a list of literature articles that we review. We add a results section, a couple sentences, as well as a significance section, which describes the article, what are the main findings, and why do we care about it. They vary between, Lancet, JAMA, New England Journal of Medicine, various journals, as well as some that are peer reviewed. They haven't yet been peer reviewed, but they've been published in accordance to significance to the public health body. And we would appreciate any articles that you may come across that you find relevant. That we can.
Claudia, you're awesome. Thank you.
And I just wanted to tag on to that is that, we know that there's so much information out there in the public. And, our data analytics office is a resource for the community. So they really, they go through all of the literature and they break it down so it's easy for digestion and to understand what we are using as evidence-based practices and where we are, the why behind our recommendations. And so I encourage folks to go up on our website and read through that information because, information these days is so vast, far and wide, and we know that there's a lot of inaccurate information, misinformation that is out in the public, and we want to make sure that folks know the source of information that they're getting credible information from, including our agency. So we have like a big bibliography and we have all of the information within those reports, and nothing happens without a team. And so with Fadi and others and Dr. Johnson and Deanne and Michelle, our PIO, I mean, it's a team effort that is able to produce this easily consumable, credible, accurate, timely information, as we know that as the evolution or, with this response and the science changes, we want to make it as easy as possible for people to have easy access to understandable information. So
Dr.
thank you, Fadi,
Johnson.
for remembering that.
Yes, welcome.
As Stephen Goodwin would say, it's enough to make those of us with a geekish.
Yes, I check it every day.
Right?
Yeah.
But, and truly, I think what it does is make it approachable for everyone to really look at those peer-reviewed and why we look at this data as being dependable.
Right.
So, thanks, Fadi. So as I'm sure you're all aware, last week we changed our regional hospital capacity banner. This is a residual from when we did have a dial, but has been developed as more of a fluid. It doesn't have a particular metric. It is developed in conversation with our hospital partners and the pressures that they are seeing. It is a consensus across the 3 hospital systems with public health around changing the dial color, or the banner color rather, with the language to what they are experiencing within the facility. And you can see that our hospital capacity, this is census. This is not only the number of admissions per day, but reflects how long these patients are staying, so how many beds are occupied over time and each day that we look at by just COVID patients. And so we can see that we are exceeding what we had in January. So we are at the highest census that we have had all year. The hospitals have asked us to move this banner to reflect that they are strained. They are strained by the number of beds, by their staffing models, and at this time they are beginning to limit some of those surgeries and procedures, just rescheduling them down the road that are elective so that they can deal with what is urgent and emergently presenting at their doors. So next slide. And now
So before we go to that,
yes.
I would just like to give an opportunity to ask some questions. So when you look on our data dashboard, the first page, if you know it well, the first page is only El Paso County residents and admissions. So you might see, yesterday it was at a 40% decline. And then you jump to, I don't know if it's page 6, Fadi, the hospital, the regional hospital capacity, and what Dr. Johnson has said. I mean, that's a regional hospital capacity of census related to the duration of when people are staying. And then also the yellow, so there's the blue, which is confirmed COVID, and then the yellow on the tips are just suspect COVID, possible COVID, and then that data will get cleaned up and included or not. This regional hospital, as we know, hospitals take patients as a regional system. So this includes patients that are outside of El Paso County in Colorado, as well as possibly some other states. And so wanted to just be fully transparent around what this is. And I think that it's important to note that, yes, they are strained, but with data, there's always more to the picture as it relates to what is being presented. And I want to say that because it's so important that our agency provides hyper-local data on what's going on in El Paso County, because if you listen to social media, national news, talk shows, it is just, you don't know, you can't really glean what's happening, in your local area. And so that's why it's so important that we provide transparent, objective information for leaders, for ourselves, in the community as we collaborate and navigate our way through all of the difficulties. So I wanted to point that out because I know that sometimes people don't understand, well, I see, the hospital admissions going down, 40%, and then I see the regional hospital capacity. So there's different details that I think are important that are not always thorough when presented in other public forums for the public's consumption. So just wanted to provide that. And then if anyone has any questions, because I do think it's important that we have awareness and it's staffing and the bed capacity that are being strained. And they're making plans, and they have made plans also for surge capacity, regional transfer. So there's a lot to this.
Yeah, no, you're absolutely right. Your report, school's report, Brenda's, your report, is very meaty. There's a lot to unpack, and there's a lot of knowledge. There's a lot of knowledge to be gained behind the information, and I think that's where we need to focus, is on knowledge. And this hospital group, I think, it's remarkable. And we really appreciate what you all have done to pull that group together.
Well, and this, remember, this is a regional, each one of our hospital systems here.
Yes.
In our region is a system.
Yeah.
So this also reflects that they have the opportunity to transfer up and down the Front Range.
Yeah.
It also represents that they have a statewide consortium. I don't know that they call it a consortium, but they work with the hospital association to assure that there is consistent and fluid transfer of patients among systems and locations to assure that we are utilizing all of our hospital capacity. So this reflects the strain. It is truly one of our metrics, but we want to also reinforce that the hospital's mission to care for those who show up at their door is still ever present. And they are used to, as you know, Dr. Terwish and Dr. Vu, they just make room and they absorb what's showing up. And so we want you to recognize if you're having chest pain or you think you may have a stroke, you're going to deliver your baby, the hospitals are still prepared and ready for you to show up. This is not to indicate in any way that you shouldn't be seeking healthcare when needed.
Mm-hmm. And one clarifier, Fadi, so the gaps in this, in August and September are the weekends. Hospitals are not reporting to us on the weekends. So when they have the data, Monday through Friday is when they're reporting it. So I just wanted you to have that clarification also.
Yeah, there's a little wider one because Labor Day fell into that too.
There you go.
Okay, so not on holidays either. So just know that that's not reported.
Yeah. I want to very quickly just speak to the Board of Health members who are here in the room and here virtually. You know, it's almost 10:30, but we have an opportunity here. All the right players are in the room with knowledge and may I even say wisdom. So if there are any Board of Health member comments or questions at this point, this is a marvelous opportunity, and we can certainly linger longer because of the importance of this data and this time.
Johnson does have one more slide to go over.
Oh, okay.
If I will just pause to see if any board members need to say anything and leave, but if not, then we'll proceed for another 7 minutes.
Yeah, this is particularly interesting to me, the monoclonal antibody. It's been in the news every day.
Try to make this exciting at the end.
It is
exciting,
exciting,
right?
So,
saving the best.
Can I just add
Yes.
one?
Sure.
My understanding is Manitou requires masks to go into retail, is that right, in their schools and et cetera. So do we have any data that shows, like, if we were to extrapolate them out as a, Manitou Springs, what their COVID cases and incidences and things are? I'm just curious if we have that, since they have a mask requirement.
Yeah, if I may, we do have the zip code level data on cases published publicly. Their population is around 6,000, and they typically see less than 10 cases, 5 cases a day or a week. So The zip code level data is available publicly for the cases. We also have zip code level data for vaccines, and we can definitely share that.
Okay, but Doris's question was, has the mask mandate in Manitou Springs made a difference in the number of cases?
I don't think we've analyzed that. It would be, I think just because of the small n, it would be very difficult to take them out and then use numbers that are less than 10. But we could take a look at that, definitely.
Understood. Thank you.
Are we ready to go on to monoclonal?
Yes. Favorite topic. Go for it.
Favorite topic. Okay, so when we look at COVID treatment, most treatment is first and foremost prevention,
sure,
as we've been talking about all day. Second is supportive for asymptomatic. So that includes rest fluids, Tylenol, ibuprofen, decongestants, and then the symptom watch, which is key. So when we look at medications that we can use in the outpatient setting under EUA, the only approved drug for outpatient use is the monoclonal antibody, which is why it's garnishing so much attention and is pretty exciting. It is a laboratory-made molecule that acts as a substitute for the antibodies that we would naturally develop if exposed to the virus or vaccinated. There are two that are approved, bamlanivimab, which is from Eli Lilly, and then a combination of casrivimab and imdivimab, which is Regeneron. That's the name we all know. And I just have to say those because why pharmaceuticals always choose these names is something of creates a little humor for me because they're not pronounceable. The EUA is actually for non-hospitalized patients. We ask that they be mild or moderate COVID-19 illness, and it's usually adults and patients ages 12 and older who have to weigh at least 40 kilograms. It has to have a positive result from direct viral testing and high risk for progressing to severe disease or hospitalization. And it requires that it's early in the course of symptoms. So it is typically recommended that it be used intravenously, so it is a infusion. However, there has been a movement to use a subcutaneous delivery for post-exposure prophylaxis. And there are some movements to use sub-Q, even in those who are symptomatic, in lieu of IV if there is not any opportunity for that. More to come on that. That is not officially part of the EUA under the FDA, so we want to just be careful, but there's more and more conversation, and Dr. Tanaka with Peak Vista has been following this more closely and just sent me that in the last couple of days because we can watch TV and see, like in Florida, that people are just driving up and getting a shot of their monoclonals. This is a off-label use even under the EUA, but there's more data being gathered, so we'll need to be following that. In Colorado Springs, this is available through Matthews VU, who will enroll patients in clinical trial with future innovative treatment. And there are inclusion and exclusion criteria, so it doesn't mean that you necessarily just get enrolled, but you may have an opportunity. And then UC Health was using a lottery system within their system. However, we hear as of September 3rd, there have been changes. So what we have found is that the monoclonal antibodies with the increasing surge of Delta across the nation has become much more in the forefront. There have been more utilization of these, as we've seen, like in Florida and the southern states. And so we are now at a point where monoclonal antibodies are a limited resource. The HHS, Health and Human Services, will be pulling those resources into one location so that they can be more equitably distributed, so that we can see that there is, as we see the surge of Delta spread from just our southern states into the rest of the nation, that there is access for these other states to this particular treatment. Colorado anticipates getting 1.6% of, does this sound familiar to you?
It does.
It's 1.6% of the monoclonal antibodies, which reflects the 1.6% of our population in the nation, as well as what we saw with vaccines when it was a limited resource. It will be distributed to patients based on those healthcare protocols that we kind of discussed earlier. Your point in your course of the disease and your risk factors for developing more severe disease. And so the prioritization at this point, and we'll see as CDPHE and HHS also instruct us, but we anticipated to include those who are infected over any kind of post-exposure prophylaxis. We also expect it to be prioritized for unvaccinated over vaccinated, because you already, as we see even in our hospitalization data and severity data, you fare better with your vaccine. And then third is for those who are immunocompromised, who may not mount an immune response to a vaccine or towards the infection. So are there questions?
I'd like to add that UC Health has a lottery system also to offer monoclonal antibodies. And the prevention cost of a vaccine is around $32. And the cost of the treatment is around a little over $2,000. So you can see that the old saying of an ounce of prevention is worth a pound of a cure, that the vaccine cost and prevention is a cost savings also, but it's a wonderful option to have treatment. So I think that's fantastic. But I just wanted to provide that perspective too, for those that may not be vaccinated and what we're seeing in hospitalizations and have the severe outcomes. That this is a treatment, limited supplies now. But there is do the calculation on how costly that is also.
And if we look at hospitalizations, it's 10 to 20 times the cost of the monoclonal antibodies. So we just escalate. We escalate the physical cost, and that is not calculating for days of work, years of life lost, and some of these other abstractions that we make as we look at treatments in public health.
Yeah. So do you know if HHS is going to ramp up production with these companies of these antibodies so that we have more?
I'm sure there are conversations. I am not aware of what those entail, but yes.
That's what we're hearing. The state health department, they're ramping up, I understand, to put together teams and to be able to equitably distribute the supplies. And we would anticipate that based on our population, then they would distribute to us. But I understand that that's something that they're going to focus on, not only with Health and Human Services, but also at the state level, because we know that, some states have been really, they've been experiencing just having a different experience, some of the southern states versus Colorado, but there needs to still be equitable distribution of the treatment. So I know that is a focus area of there. So we'll provide more information, but I believe that efforts are ramping up on that front too.
I have a question on the person that gets the COVID. And how do they get tested to see how their antibodies are?
So,
or is there anything to that?
So antibody testing is a yes/no proposition. You have antibodies or not, but we don't have an test that adequately or accurately gives us a feel for the efficacy of those antibodies and the depth, because we need T cell and other factors besides just the antibody to truly fight COVID effectively. And so much of what we are following with those antibody tests over time is that clinical perspective that we see in whether patients actually do experience reinfection and or severe disease. So there's still more to come. That is based on the life cycle of the virus, based on expansion of our immune system and the timing of it. So it's not a one and done.
Yeah. Where are their antibody tests being offered? I don't know, Dr. Vu, or that's what you're asking too, right?
Yes, I'm, this is something personal, so that's why I was wondering.
So two things. Number one is antibody testing for the patients with COVID infection does not determine if that patient would benefit from monoclonal antibody or not. Number two, antibody testing is widely available, really. LabCorp does it, any hospital would do it, Quest does it. So pretty easy to get it done. It's a blood test.
Okay, now what about getting the vaccine after that?
Okay,
Good,
so.
good question. That's
where I was headed.
Yeah, you drilled right down on it. Okay, here we go.
Should we test patients who have been vaccinated to make sure that they develop enough immune response to it? Either I can address it, you can address it.
Go ahead.
Okay, so yes, you can certainly test someone who has been vaccinated to see if they have had an immune response to the vaccine with the antibody testing. But testing for the antibody does not add any clinical significance to the management of that patient, except in few instances if a person is immunocompromised. So testing for antibody after getting vaccine is not recommended because it does not change any treatment, does not change any recommendations in terms of isolation or quarantine protocol. In addition to that, testing for antibody after getting a vaccine does not differentiate if that antibody was created by the person from the vaccine or from any previous infection. So therefore, at this time, we don't recommend routinely testing patients for antibodies after getting vaccines.
What about after getting the disease?
So the question is, after someone gets a disease, should we test that person for antibody potentially so that they may not need the vaccine? And the current recommendation is we do not routinely test for antibodies for all patients who have been infected because that does not change the recommendation if that person still needs a vaccine or not. The current recommendation is even after you have been infected with COVID-19, you should still get the vaccine and should get two doses of the mRNA vaccines or one dose of the vector vaccine. And if you meet criteria for the third dose, you should still do it independent of your infection status.
Thank you.
Yeah, and the data really is, remember, we're following this over time, and Israel has been a good kind of closed community cohort for some of these studies. The studies really support that those who have a native infection still fare much better when they have that vaccine consistency to add to their immune system.
So I just have a couple of more things, not COVID related.
Okay.
So thank you, Dr.
Thanks,
Johnson.
Dr. Johnson. Thank you.
We have been persistent on trying to recruit a community health promotion division director. And we are happy to welcome Heather Graves, who has over 20 years of leadership experience working with in community-based organizations and healthcare, and most recently with Children's Hospital. She is thoughtful and a collaborative leader with expertise in relationship building and community partnerships. And she also has a proven track record of successful staff development and mentorship, along with innovative program design, development, and implementation. And we are just thrilled to have her join our leadership team. And Heather, I'm wondering if you're still on the line, on the call, and maybe you pop up and say hello.
Ma'am, good morning, everybody. I certainly don't want to be the person to stand between the end of the end of the meeting, but nice to meet you all and see you all, Lee, and I'm really excited to be here and dig in. Thank you, Susan.
Thank you. And you know, one of her division is one of the largest areas and really has lots of impact on, you know, population-based services and stuff. So we're just really happy that she's joined our team. Thrilled. And one other thing I want to just take a little bit of time to recognize all El Paso County staff and the tremendous work that they're doing. And I really appreciate Dr. Vu that you're giving us encouragement on being the light to the darkness, and appreciate that, because I cannot emphasize enough how incredibly talented, thoughtful, kind, professional, innovative, customer service oriented, all of our values that we stand for, all of our employees demonstrate. And I know how hard they're working. And, you know, this is something that I'm really passionate about, and I hope it doesn't bring me to tears.
That includes you, you know.
We have been at this for 19 months. We have not skipped a beat. Head up, shoulders back, and handle it. We're tired. We are working in the evenings. This presentation, we worked on in the evening because our time is filled with other COVID responsibilities and how seriously we take it. But I want you to know, throughout our agency, every single level, the burden that is on local public health and the work that my team is doing. I wish I had a magic wand for each team member and to provide them resilience and rest and rejuvenation. We've got an incredible team here. You know, from Fadi to Steven to Haley, everyone that you see, there's 10 or 20 more than you're not seeing that are working incredibly hard. I talk about how stretched we are. A community our size usually has steady state 256 full-time employees with a population of 500 to 1 million. Our steady state is 158. We continue to ramp up, surging to meet the needs, which is an ongoing challenge. We have about 180 FTEs, including some contractors. But I want you to know that this team is amazing. Local public health, they are, you know, being the light. The volatility and the vitriol and the anger, it shows up to the boots on the ground as well as at the top, but they're facing it every single day. They are doing phenomenal, exceptional work. And I know you all know that, but I just have to say that because I'm just so impressed by them. And I appreciate acts of kindness that there was a school district that provided our community disease team lunch. They're acknowledging, you know, too, in different ways, you know, our Chamber of Commerce, our economic development. I mean, there's a lot of people that are encouraging us in the community, and I so appreciate that, but I couldn't do it without this team. I mean, I just can't even, I mean, it's just, I'm so grateful.
And they couldn't do it without your leadership, Susan. You know, it's hand in hand, and we all appreciate what you and your staff do. And you shouldn't have to work this hard. And so my thing that we need to start thinking about is how can we be more supportive and how can we get more funding and get, you know, so that you can compete with the other places that are trying to employ nurses and other personnel so that we can, I just don't want I don't want anybody at the breaking point. That's just not what we're about.
Yeah, and you guys, all board members are extremely helpful, and we appreciate your support. You all have approved critical funding back in 2018 for 2019. There's no way we could have mounted the response without the additional critical funding with the Board of County Commissioners, so that's been a start. We do have a lot of funding with the different grants. The challenge is recruiting, competing, maintaining, not only staff, but resilience. People are burnt out, and there's just a lot to unpack there. And you all have been tremendously supportive. And I'm just giving you where I feel it's my responsibility to speak up for those that may not be here, whether they say so or not. I mean, I know folks are tired, but they're not skipping a beat. They're not lessening their quality. They're so dedicated, and they fulfill, all of our values. I think that we're in incredibly difficult times, because even if we had additional money, there's so much that goes along with trying to recruit and maintain and train to ramp up, but compete, at the salaries also that are needed to compete even with nurses. That was a problem before COVID, and it's continues to be a problem. So you all are very supportive, and we couldn't mount this without you. I just wanted to let you know how incredible all of our employees are at every single level throughout the agency, and they're doing phenomenal work. And I think that's so important, because there's a lot of noise and people, whether it's in different forums, or directly, or with some of the phone calls and the interactions. And Haley talked about the reduction of participation, also in the contact tracing. So I mean, there's just many challenges, and I just commend my team, and anything that we can do for them and show acts of kindness and continue to lift them up is where I want to try to continue going. And then all of the staff that we have been able to hire, I want to keep. So
For sure.
This year, next year, and future years. And I want to continue to ramp up. So that's another area where my focus is related to funding. And I apologize for getting emotional, but I think all of us are carrying a lot.
Yeah.
Have been carrying a lot.
Yeah. No, I think it's terribly important that we speak truth to each other. And I appreciate that you would be transparent with us and share your feelings. I also really like your magic wand analogy. I don't have one either, Susan, but if you go back and look, and this is addressed to our Board of Health members, myself included. When you go back and look at what in the rules, the bylaws and the regulations of the Board of Health, our responsibilities, our tasks or duties are rather circumscribed. It's like a sentence or two. And number one amongst those is support the health department and support the director. So Susan, you have our full attention, and we get it, and that if it takes additional time, and if it takes additional meetings, and if it takes additional encounters with folks who do have the resources, we have access to quite a bit, but but additional resources, then I just want to commit that we, the Board of Health, are going to support you in that. And we can't magically materialize the staff that you need, but hopefully with additional resourcing, we can attract sufficient qualified staff to help. I know it's not going to be immediate. It may not serve our immediate needs, but I think the goal, and you've been very consistent in this, of 258, I think it was, that we need somewhere in that here at the health department for a population our size. I think that's a goal that's achievable. I don't think it's an aspirational goal. And I think in the environment of public health post-COVID, that's where we need to be. So thank you for your comments, and thank you for your staff.
And I appreciate that. I just, folks are working, Monday through Friday, Monday through Saturday, Sunday, evenings. And this is not a one-time thing. It's steady. It's like a steady state for many of us. And, without increased capacity or changes, and it's not going to come immediately, no one can sustain that. We've been at this for 19 months. And it's we all have hope that things are going to get better. And we've presented today the stepped up preventative actions that we're all taking. And so we're doing all that we can to meet the needs and mount the response that we need. But we have a phenomenal team. And I just hope, I wish I had a magic wand for many reasons. But thank you. I appreciate your support.
Thank you.
I don't have anything else.
I have a little note here that says no public comments. Is that still the same? Okay. Any saved grounds from Board of Health members? Any final thoughts, comments? All right. We're adjourned.